Good evening and welcome. I'm Mark Alexander, and I'm the chair of 100's Health and Wellness Committee. Welcome to 100 Black Men of America's national webinar entitled Mental Health, Preparing for the Holidays and Winter Under COVID-19. This webinar is one in a series of national forums that 100 Black Men of America has produced to help protect our communities from the scourge of the COVID-19 pandemic. We will continue to bring you information until we are safely out of the grips of this deadly virus. I would like to acknowledge our partner, the National COVID-19 Resilience Network at the Morehouse School of Medicine, and Pfizer, a supporter of 100's Health and Wellness mission. Our nation has been paralyzed by the COVID-19 pandemic for over 9 months. And the virus has infected over 11 million Americans. It has killed over 250,000 people. Unemployment has skyrocketed, and scores of families are at risk of losing their homes and of food insecurity. These dreadful events particularly impact our communities. We are all aware that a disproportionate burden of poor health, early death, and economic hardship is due to the pandemic is being experienced by Black people. A phenomenon termed pandemic fatigue has developed as a result of the dramatic deterioration of the nation's mental health. According to a Kaiser Family Foundation poll, nearly half of all Americans report that the coronavirus crisis is harming their mental health. Our children are bored, anxious, and frustrated. We are experiencing a dramatic spike in depression. The prevalence of anxiety disorders are approximately 3 times those reported in the same period of 2019. The prevalence of depressive disorders is approximately 4 times that reported over the same period last year. Domestic violence is rising. A study at the Brigham and Women's Hospital in Boston found that being confined at home over a long period of time increases the likelihood of violence between intimate partners. The number of people with suicidal thoughts is spiking. A federal emergency hotline for people in emotional distress registered a more than 1,000% increase this past April compared with the same time last year. Mindfulness plays a prominent role in the 100's Healthcare 2.0 initiative, and we have assembled an outstanding panel of mental health practitioners to provide strategies for protecting the mental health of vulnerable populations during this pandemic and beyond. Before we begin, I have asked Dr. Eric Griggs, a member of our Health and Wellness Committee, to frame this evening's webinar with a personal story based on his experiences serving our community in New Orleans. Dr. Griggs? Okay, well, he may be joining us later in the program, and he'll share that story with you. So now it is my pleasure to introduce the moderator for this evening's webinar, Zelda Johnson. Zelda is the CEO of the Natural Hypertension Institute, founder of the Z Protocol, and she's a member of the 100's Health and Wellness Advisory Board. Zelda?
Thank you, Dr. Alexander. Those statistics are concerning, and that's why the Health and Wellness Committee would like to make this webinar an opportunity for you to ask questions in a safe place with our diverse specialty practitioners and panelists. Now, this is an interactive webinar, so please place your questions in the chat box. Let's start with a poll. I'll read 3 multiple choice questions. As I read the choices, wait and add each letter that is your choice, then hit the return. That way we can see all the choices for one person. I won't wait for your answers. So here's question 1. Do you feel that you would like to speak with a therapist or do you know someone who could use the help of a therapist? This is multiple choice. Is it A, you feel like you need one? B, you know 1 to 2 people? C, maybe 3 to 5 people? D, 5 or more people that you know possibly could use a therapist? Get your answers in. You can have A, B, C, D, or a mixture of them. Then hit the return. All right. Here's your second question. Do you think COVID has caused the need for therapy? A, yes. B, no. You just want one. And try to get your answer in our chat box. And the last question, why have you or the other person not received therapy? A, this is multiple choice. A, don't know a therapist. B, want a Black or brown therapist. C, don't want anyone to know nor want it on my medical records. D, it's too expensive. E, I prefer to speak with my pastor, family or friend, my barber or hairdresser. And while everyone is taking time out to put their choices in the chat, I'll introduce the panelists. We have Free Brown. She's a licensed psychotherapist in California and Texas with over 10 years of experience. Her clientele includes those who are unhoused, veterans, prisoner reentry, those living with HIV/AIDS, youth, and seniors. She's the founder of Sankofa Garden, which merges horticultural therapy, garden therapy, education, and food sovereignty. She's the owner of TheraShare, a co-working space for Black therapists and therapists of color. Dr. Eric Griggs is a medical doctor based in New Orleans and specializes in community medicine and health education. Doc Griggs, as he's called, his mantra is get checked, get fit, get moving. He appears weekly on Fox Channel 8, WVUE, Morning Edition as a health educator on Thursday morning at 7:40 a.m. He also broadcasts every Tuesday with the Doc Griggs Show on WBOK AM radio 1230 from 3 to 4 p.m. and is a contributing medical writer for 2 community sources, Data News Weekly newspaper and Breakthrough Magazine. Dr. Kofi Kandwani is the director of the Mind Body Clinic in the Counseling and Testing Center at Georgia State University and is the assistant professor in the Department of Community Health and Preventive Medicine at Morehouse School of Medicine. He's participated in several clinical trials with the National Institutes of Health, Department of Defense, and the current National Center for Complementary and Integrative Health. He continues to investigate meditation's effect on blood pressure, diabetes, metabolic syndrome, and other cardiovascular diseases. He's taught thousands of individuals in hospitals, prisons, clinics, schools, corporations, and low-income communities. Miracle Holloway is an R&B singer, inspirational speaker, and actress. She was a contestant on season 17 of The Voice and is founder of You Matter to Me Foundation, which mission is to focus on healing strategies for individuals suffering from domestic violence, low self-esteem, anxiety, and depression. Miracle uses her gifts to empower and uplift. She has sung background for Toni Braxton, Earth, Wind, and Fire, Kashif, and other artists. She's acted in commercials and the Marlon Wayans sitcom. I invite everyone to read our panelists' full bios on the 100 Black Men website and our resource page. Let's see what the trending answers are for our poll in the chat. So it looks like for number 1, yes, COVID is indeed an increasing source of a need for therapy. Then we have, it looks like people are interested in a therapist, speaking with a therapist. So this is good to see. And then let's see, why have you or the other person not received therapy? It looks like it's all of the above. I don't know a therapist. I want a Black or brown therapist, and you don't know where to find one. You don't want anyone to know nor want it on your medical records. It's too expensive. And then they also say They prefer to speak with their pastor, family, friends, barber, and hairdresser, which pretty much is the African American experience. So here's the question for our panelists. Why the misconceptions about mental health therapy? Free, I'd like to hear from you first. So perhaps Free is working on her audio. Dr. Griggs, tell me about misconceptions. What's going on that people are afraid of mental health therapy?
Oh, I see. I think we all put ourselves on mute.
I think so too. So would everyone unmute? We'll go back to Free. Would you answer, please?
Okay, so just talking away. All righty. So one of the barriers, we have to look at the historical perspective of African Americans interacting with the mental health field or the medical field. There's a lot of distress, and it's warranted. You know, you could be sent off to a psych ward way back when. Dryptomania was actually a diagnosis where they would diagnose slaves or enslaved people for wanting to get out of slavery. They considered that a mental health disorder, wanting to flee. So it's ongoing distrust when you don't have clinical professionals who look like you. And no one wants to be labeled as crazy. And so within the African American community, if we don't say it out loud, then we can pretend that it doesn't exist. So I believe having a lot of therapists of color coming out front and center kind of demystifies the process of coming to mental health services. And I often tell patients, you go to the gym to make sure you're well. You don't wait until things fall apart to seek services. Mental wellness is kind of the same thing. So there is definitely a turn. The young people, you know, it's a part of their culture to say, hey, I have a therapist, I check in with someone. I think it's turning around, but it's definitely distrust that's warranted. Yeah, in the system that kind of limits that. And then of course, finances and not knowing where to start.
All right, Dr. Griggs.
Yeah, so as I was very mutely saying, part of the issue traditionally through the generations, you talked about dryptomania and the diagnosis of mental illness if a slave wanted to run away. Well, that translated and was passed down through the generations to the point that, you know, growing up, if someone had a mental condition, it's the holidays. During a family holiday, you would put them in the back room. They would have their plate. They'd have a good day or a bad day. No one wanted that stigma. No one wanted anything to do with anything that was quote unquote crazy. The travesty in that is that in the midst of all of our community terms and perceptions, jargon changes. The words we use in medicine, healthcare, and our respective profession changes. And in the midst of that, there's no distinction between mental health, which we all need, which is a good thing, and mental illness, which is a lot of times based on experience, based on chemical interactions, all of which can be treated and can be accepted as normal. But there's this stigma. The moment you say mental anything, as a matter of fact, colloquially growing up, you're like, dude, no, man, my mom's going mental today, bro. Just stay away from the house. And we knew to leave mom alone because mom was having a special day. And mom better not hear you call her mental, or else you're going to get that, you will get disciplined. So the distinction and the focus on things on wellness and these terms of centering and finding your truth, and those things need to be, they're coming more into fruition. People are more comfortable saying they're talking to a therapist. People can find, I'm actually running into African American children that want to be therapists, which is a great thing. That's a change in the system that is very much needed, very much needed. So yeah, so distinction of terms is one of the things. We just have to keep talking about it and be open with our conversation.
Dr. Kandwani.
Yes, I see a lot of the issues stemming from the relationship between mental health and religion. And that most African Americans, when you talk about something dealing with the mind, you're dealing with religion. And they cordon that off to be dealt with pastors and imams and folks like that. So I think that's an issue that we need to bring together. As he was saying, as the doctor was saying, is defining these terms and these things that go on mentally. So I think some dialogue and relationships and interaction between those that deal with the spirit and those that deal with the mind would be helpful in resolving this stigma issue. Were you able to hear me?
I can hear you.
Okay.
To loop back to what Dr. Kofi was saying about the separation of spirit and mind, that's an interesting component. Black folks seem to not want to separate the two, and then you have clinicians who are very trained in a whitewash system that says we focus only on the disorder, nothing else. We don't look at the system around the patient or the person, systemic racism, housing issues, spirituality, nothing. It's just a disorder. And so that separation I feel alienates Black folks as far as coming to therapy. We want the wholeness of us addressed. And that's kind of a downfall sometimes of the system, is to only address the mental health, but not all the other components. And so with us, if you don't get it right and we're not comfortable and you miss the mark, you don't have to worry about seeing us again. So that was very interesting, the mention of separation of spirit and mental, when that's not the case in real life.
So ignoring that can be a real problem, a huge problem. And while we are on this topic, I'd like to talk about how it would manifest by a real world situation. So I'm a community medicine doctor. What does that mean? Everyone's like, oh, that's great, community medicine. No, while I don't see patients, I chose not to take the traditional route of medicine because I didn't like where it was going. People ask, Doc, why didn't you see patients? I say, I don't like sick people. And they were like, wait, what? No, I don't. People that are sick stay sick. Whereas people that are well gravitate towards being well. And I'll take care of sick people too. That was a joke. But I went into clinical research and I spend my time in the community working with people, policy, and practice. Much like in our world of psychiatry and mental health that we're talking about, you don't see many of us in the policy rooms when they're made for the people, for us to practice. So it's my job to work in the realm of health literacy to make sure everyone understands everything. Most of the time people will go to a specialist and they smile and they do exactly like this. Yeah. Mm-hmm. Then they call me up and be like, what'd he say? And I can say the exact same thing. And they'll be like, say, bro, why you ain't say it? He should have told me that. So interestingly, when it comes to issues of mental health, let's just take the elephant in the room and put it in the middle of the table. We're in the middle of a pandemic. COVID-19 is like something that we've never seen ever before. And here we are in the middle of our holidays, which is time that we're supposed to be together. And they're telling us that we have to be apart. Since this thing started, we've started another pandemic, and it's called a mental health pandemic. Due to the isolation that a lot of us feel and the COVID fatigue, right? So what's happened is anything that our anxieties and our insecurities that we might have had, with everything being unknown, and I can honestly say in the last 8 months, everything that I've said being discredited by the top office in our country, saying that all the science that I spent $500,000 trying to learn and memorize is not true. People have nowhere to turn. Well, this is a very real story from the community. Again, I'm everybody's doctor. I get a call from a friend of mine early on in the summer, say June, saying that his mom, who is my age, his mom is in her 70s, is all of a sudden having trouble sleeping. She's having trouble sleeping, not sleeping for 3 days at a time. We watch it. We finally get her to therapists. They try to help. It goes on. Well, the George Floyd, the unfortunate incident with George Floyd happened later in July. It started again, and to the point that she could not sleep. So she ended up being hospitalized into a mental health facility, a long-term facility. Well, an inpatient facility where she was properly treated. But when she was let out after a week, there was not proper follow-up. The anxiety started again, and she started watching TV. Then all of a sudden I get a call, same call from a friend saying, "Hey man, my mom's missing." So there's a search party. We're looking for her. Apparently she had taken all of her pills, her blood pressure pills, her psychiatry pills. She took all of her pills, and she was found asleep in a park, passed out in a park. We got her into a hospital facility. She was treated. There was electrotherapy, which is not any of the archaic stuff that you think about. She was properly treated, and everything was going fine until I get a call again from this same friend saying, "Griggs, I need your help." "What do you mean?" "My son, who's a freshman in college, I'm having to go pick him up because he's having a nervous breakdown." So we had to go with him to the hospital again with his son, because part of the nervous breakdown and anxiety of the son was that this grandmother he knew as a rock in the family had a weakness in his mind, or had an issue. Now, mind you, since then, all of them have been in the system, quote unquote system that we don't trust, but it worked. They've been in therapy. They have therapists. Now my friend is going to therapy, and they're talking and dealing with the anxieties of COVID-19. We're dealing in the anxieties of the unknown. And I try to stay as apolitical as possible, but we just had an election, and I'm really, really glad. I feel like an albatross has been, and a weight's been lifted off my back, and an albatross is out of the way, so we can get back to the work of trying to put us back together again without being discredited, without having the PTSD of trying to run around our block and not knowing what's gonna happen. Mental health is something that needs to be addressed in all of our families. The funny thing is, the more we try to put pressure on ourselves to look like, I'm going to age myself, Ward and June Cleaver, or the Brady Bunch, the more damage we do to our families. Everyone has the same people if we describe our holiday scenes and parties and the people in our family, it sounds just like someone else in our families, which means that the common seam of love that we have through our families, with that runs anxiety, depression, fear, ego. All the things that hurt us and damage us are things we need now to turn out, so we don't end up in the same situation that my friend was in. I mean, that situation put stress on me. I found out what PTO was. I need to take some time off, personal time off, whatever you call it, to pay me to take a chill. Yeah.
Well, that's excellent, Dr. Griggs. That's quite a story. So our audience is asking about several symptoms, including depression, trauma, grief, domestic abuse, self-esteem, and stress. That's perfect. You said that, Dr. Griggs. We'll talk about that free. How can adults recognize the signs of depression in their youth, and how do you talk with them about heavy feelings? We've got a large mentor group in the organization. How should mentors talk to young people about their own heavy feelings during this time, especially when there is experienced grief and abandonment, like Dr. Griggs mentioned, feelings of suicide or trauma?
With children, with youth, I think we believe, just outside looking in, that if we don't talk to kids about things that they'll know, that they won't know that there's an issue or a problem. And the thing about children is that they're very perceptive and receptive. They can feel that something is wrong, even if you try to hide it from them. And I feel it makes them uncomfortable when you don't come forward with age-appropriate honesty. I would imagine, a lot of talking to youth, I use the phrase, I would imagine that this is what you're feeling. This is their first time at this. This is our first time at this COVID situation. But this is their first time at heavy feelings and being confused about how to name things and put words to things. And what the kids are saying is that they just want a place to be heard, even if they don't know what to say. So recognizing depressive symptoms or anxiety symptoms in children is just as simple as saying, you know what, I would imagine this is heavy. I would imagine that you're not, feeling the way you think you should. You're acting out, you're talking back, you're missing in action. Are these some heavy feelings that you're experiencing? And being quiet and allow them some space to say things out loud, and not making depression or depressed feelings or heavy feelings seem as if something is wrong with them. Are you ain't depressed, are you? It's like, well, no. Well, you know what? Yeah, let's make it an open environment to have those honest conversations about heavy feelings. So recognizing symptoms can vary from child to child. A child that's normally outgoing becomes quiet. A child that's quiet becomes withdrawn. So really paying attention to our young people and just asking them about it and sitting back and allowing them to explain the best way they can. It may not always be the need to immediately rush them into therapy. Oh, you got to go to a therapist now. It could just be, let's go for a walk. Let's just take some time out and sort these things, sort these things out. Does that make sense? It's just really giving space to the child to at least air some stuff out, but that's also modeling for them as adults. How do I communicate as an adult? Hey, you know what? Today I'm feeling kind of down. Tomorrow I'll feel better, but today I'm kind of off. It models how to move through and bring those heavy feelings to life too.
I like what you said. I'm not feeling well today, but tomorrow I think I'll feel better. That's an excellent model for children to see. Now, Miracle, I'm concerned about youth who have lost loved ones to COVID. Does abandonment as a child play a big role on an adult's social skills?
I believe it can. I can speak and use myself as an example. I did not even know that was the issue until I was able to get to the root of it. By being abandoned at a young age by my mom. She left me with my dad, and then my dad not being able to raise me much longer as a kid, and then sending me to my grandparents. So all of that just was a big thing for me. So when people will come into my life, and just as a friend, or if someone was in my life just for that season, if it was just for a season and they weren't in my life anymore, I would feel a certain kind of way. I would think automatically, is it something I did? Did I do anything to cause that person to, not want to be in my life anymore? But until I really began to get down to the root of why am I feeling like that, when I know that there was nothing that I did wrong, it helped. I know it helped me. I know it helped me. So I hope that was a good enough answer.
Now, I'm wondering, what social skills are you thinking of you felt were?
I know being, as far as my social skills, as far as being a people pleaser. Because of, if I'm doing everything that they want me to do, then they won't leave out of my life. And I associated that with my childhood. Maybe there was something I didn't do. I didn't do enough as a child. Maybe that's why my mom had left, and then my dad couldn't take care of. Maybe there was something I did. I didn't do enough. So I had carried some of that to my adulthood, and that affected some of my social skills.
I see.
Yeah.
You have a foundation.
Yes,
you
ma'am.
added to me. Let's take a look at one of your videos about the foundation. Delmar.
I need you now. I need you now.
And I ran upstairs screaming, telling my grandmother and my mother.
Did not conquer this last year.
19, I was still with him, and I allowed him to talk me into.
The second I moved into that apartment,
up mad, like angry. And as soon as I got up just to see what was going on, he punched.
It's just not me. You know, I'm gonna continue to love him, continue to, I still got, like I said, I still got so much to live for.
I think every woman watching that video can relate to some small story that relates to domestic violence. According to a report that was published in August of this year, we're seeing more instances of domestic violence. In some cities, a 27% increase in domestic violence arrests. Miracle. What are some of the signs or red flags of an abuser? Miracle? Are you off mute? Did we lose Miracle?
I see her.
Okay, I'm back.
There you are.
Yes. So that video was a snippet of the virtual event that my foundation put on. You'll hear women's stories. The first woman that you saw, that was my mom. And then when you saw me, that was my mom sitting with me. And you'll hear intimate stories of women sharing different events in their lives where they had experienced domestic violence and abuse as well.
So tell me, Miracle, what are some of the signs or the red flags of an abuser? So many times we excuse things. Can you tell us with your experience?
Yes. Being jealous is one. Not just a little jealous, but insanely jealous. Like for me, it was like, even if a guy looked my way, my abuser at that time, he would say it was my fault that the guy looked at me, like I caused that. Or controlling like what I wear, like what I have on is too tight. Everything that I have on is drawing attention, or I need to change. Or another big one is isolating you from your family, always wanting you to be around them and not be around your family.
All right. Why do so many women feel that they did something wrong? They feel guilty of something they didn't cause. Is it low self-esteem? And if so, how do you build self-esteem? And what age can we really try to help mold our children?
I do believe that it's a part of low self-esteem. And another part is...
I can hear a question about guilt. I apologize. I have a little bit of a lag. Can you please restate the question if that was directed to me? I'm sorry.
Hello?
So Free, you want to be on mute, please?
But you still speaking to me?
Yes, Miracle, you can.
Okay. Yeah, so a part of it is low self-esteem, and then there's another part. As a woman and just a young girl, sometimes I know for me, it didn't feel like I had that voice, like I could speak up. And so you think maybe for me, just as a woman, because of, maybe it was my fault because maybe I was dressed a certain way, even if it was just, I always go back to the dress, this a simple, just a nice dress, nothing too revealing, but just, maybe it is my fault. Maybe I smiled too hard or something like that. So yeah, and a lot of it can come from low self-esteem.
All right.
Yeah.
I see. Dr. Griggs, walk us through what a person seeking mental health therapy can expect from a clinical perspective. Clinical therapies. Tell me about medical record confidentiality. We had a couple people in the chat say, I don't want people to see that I had mental health services in my medical records. I want to know what my specific patient rights are when I have mental health therapy.
So your patient health rights are the exact same as they would be if you were going to the doctor for a clinical visit. We, again, need to remove the stigma I don't want to lose the word mental, but we need to include the word mental when we think about our health. So the exact same rights that you're afforded when you go to the doctor for your health are afforded you when it's a mental health issue. What you should expect is you get a referral to a therapist and everything that you talk about is confidential. It's confidential. It's confidential. It's confidential. When you're leaving your job, you're not obligated to tell someone, hey, I'm going to go meet with my therapist at 1 and I'll be back. You don't have to tell anyone anything. It's your right and it's confidential. And that helps to remove the stigma. What you should expect is the same thing you should expect on the clinical side, on the clinical process. If you talk to a therapist and there needs to be further intervention, if there needs to be pharmaceutical intervention, you'll be referred to a doctor, a psychiatrist, or someone that can write those in conjunction with your what do you call it, your talk therapy, in conjunction with your other therapy. If there is a special need or a special diagnosis or a special situation that needs to be further treated, then you'll be referred to a specialist. It's the exact same. It's parallel and the same as in the clinical medical system. The problem is now, if we, since we're talking, and we're gonna be real about it, Black folks, we don't like going to the doctor, especially men, for nothing. So there's no wonder that we don't know what the mental health services look like, because we ain't even gonna go for a blood pressure. The moment you tell us something bad, that's a wrap. If I try to go to a therapist, if Dr. Kofi gets me to go to the doctor and I try to tell him I'm having a bad day, and that doctor say, hey man, you're a little crazy, I'm gonna give you a pill, I ain't never going back. And I'm not talking to Dr. Kofi again as my friend, because my friend, he's just trying to make fun of me because I'm not crazy. That needs to go away. We need to remove the stigma and understand, and it's generationally in our race, in our community. It's a stigma that's been passed down for hundreds of years, and its root started at that ship that brought us over here, and it prevails today. So attacking it head on, having these conversations. The big thing is speaking up. Nothing makes you feel better when someone else says, me too. When I go on TV, I said, first of all, y'all, pardon my medical term, but I'm tired. This sucks. I'm over COVID. I'm over masks. If you talk about it too much, I'm over you. And do you know when I say that, everyone relaxes and they're like, me too. Saying that I'm anxious, I'm scared, saying that I'm depressed, I'm down today, saying that out loud, even when you're talking about domestic violence situations, it's empowering to know that you're not by yourself and have gone through the same experience. So again, having these conversations and having these conversations, these panels are really helpful. And Dr. Kofi, you can still be my friend. I would go.
Thank you. I appreciate it.
You're an excellent doctor, and you have that relationship with a clientele, the population that needs someone like you. But we all can't get a doctor like you. What do we need to do to ensure that other providers, practitioners, are able to talk to clients the way you do, or patients the way you do? What kind of training needs to be done? What message or communications campaign?
So now you're jumping into the realm. You're all into my swimming pool in my backyard. Health literacy. People think health literacy is just the doctor talking to the community. No, it's a two-sided coin. If you look at the relationship between sender and receiver with the message in the middle, there's this important arrow that people leave out, and it's the most important arrow. It's called feedback. And that guarantees that by the time the sender and the receiver leave, they have a mutual understanding. You have to shut up and listen to people when they're talking to you. That's it.
This is a point in cultural competency. And I know, Dr. Kandawani, you do a seminar on cultural competency. I'd like to hear your views on this.
That's my friend.
I'd like to share two views. One, yes, it's very important. Culture counts when it comes to interacting with your patients. You can make a mistake in the first 30 seconds of your encounter, and that patient won't hear a word you say for the rest of the time that you're there. You know, like one of our elders that come to the doctor, and it's a doctor from another culture that calls you by a first name and pats you on the back. And, we don't go for that. And we're not going to hear from that. So we need to have our physicians interact with our people. That's the best way. My approach, though, with mental health, and I want to get this in before the time goes by, and that is there's a way to help us heal before we need to go to the doctor, so that we can set up the conditions within our own mind where we settle our minds down, which settles the body down, which then the body begins to heal and purify, and so does the mind. So a lot of these things that fester into a problem that needs medical attention can be avoided if we just sit back and know thyself. That's what the ancients told us, know the self. And if we know who we are as an individual, then it's harder. It's like Dr. King said, that if you're standing up straight, nobody can ride your back. If you are clear with who you are as a person in this universe and a person within your own mind. See, if you're not happy, if you're not settled within your own mind, then you're not going to be settled within your house, and you're not going to be settled within your community. So once you know who you are, if you have to stay in a place for a year, you can do that because you are this infinite being with all of this spirit and all of this energy and all of this intelligence. And we're not tapping into that in any systematic way. And in my clinical trials that I've been involved in, we have found that when you be still, your blood pressure comes down. When you be still, there's things that changes in your blood chemistry. When you're still, there's things that change within your brain waves. So these things have been measured for years. In fact, over time, we've been able to see that people who learn how to be still early live longer.
Yes.
So why aren't we doing that? You don't have to pay for it. You don't have to go anywhere. All you have to do is set up the conditions and let go, like diving. And we can do that, and people can learn how to do that and have experiences from that immediately. And that continues to accrue over time as you go along and continue to take some time. We've got too much stuff coming at us from all of these different places, from the time we wake up in the morning to the time we go to sleep, if we can sleep at night.
Oh, well, hold that thought, Dr. Kandwani, because that's an excellent point that we're going to talk about next. Miracle, you wanted to make a comment. And you need to go off mute.
Okay, you can hear me now. I was listening to Dr. Kandwani and Dr. Dr. Eric when he was speaking. And that's why I feel like it's so important, piggybacking on the Me Too. It's so important to, I'll speak of myself, when I've been to a place where I've had the therapy, or now that I am more aware, self-aware of what's going on with myself, I feel like it's so important. It's my job. It's imperative for me to share what I have learned to those who I know who may need it. Though I'm not licensed, but I have a degree in experience, in life experience, and what may work for me may not work for someone else. But to share with someone that, hey, I've been through this situation. I know what it's like to be molested. I know what it's like to be raped. I know what it's like to deal with domestic violence. But these are the things that help me. And as far as the breathing and learning to just sit still, for me, it was hard because you have so much coming at you, especially with social media. Everything today is just like, let's go. And it's like I always felt like I was trying to stay within a certain time. I felt like time was getting away from me. But again, it's so important that we center ourselves around people who are where we want to be, or who we admire, or who we see, doing the things that are positive. that we begin to, put ourselves around people, women with other women, or even just men with men, or just a group of people coming together collectively and sharing their experiences to help others.
I agree with you, Miracle. And you made an excellent point. You may not have the degree, but more people like you have influence on the person who has experienced a situation than necessarily just going to a practitioner. So you have value as well, in addition to. That's why I like it as complementary model for any medical or health service that you get. There's someone who really knows the deal, as Dr. Griggs would say. So now I want to get back to you, Dr. Kanwani. How do you handle stress? And all of you can participate in that.
Gotta go for that.
I've been looking at dealing with stress for almost 50 years now. And I knew from years ago that meditation had an influence on me, but I didn't know what it meant to the heart. So I did research looking at the heart. The heart actually gets smaller in people who meditate. That's the opposite of what happens when you're stressed and full of stuff coming in. It gets larger and it begins to cause problems. We looked at metabolic syndrome, sleep dysfunction, anxiety, depression, these types of things we've looked at over time. And something as simple as just being still in a systematic way has an influence on that. And anybody can learn it. And what happens is that you not only transcend thinking, but you transcend everything in the mind. So the problems that you have for a moment, for a fleeting moment, are gone.
That's right.
Pain is gone.
Mm-hmm.
So because it takes thoughts to and all of the problems that you're thinking, when you get to a place where you're not using your intellect, you're not thinking in the language that you normally think in, you are experiencing silence. And when you have pure silence, you have no thoughts at all. If you have no thoughts, you have no problems. You come out of having thoughts, now you say, oh, I've got this again, I've got this again. But just relieving your mind from all of the pressures of the day for a moment is healing. We've been told, bring your burdens to me and I'll give you rest. But how do you bring those burdens?
Mm-hmm.
It's all mental in terms of the way to deal with the things, the physical things that are going on around you. If you can spend more time with no thing, and that's including radio, social media, all of these things, if you can experience fewer and fewer thoughts until you experience no thought, it's like a law of physics. You decrease the activity, you increase the order. And so if you decrease your mental activity, your mind becomes more orderly. You decrease your physical activity, the body becomes more orderly. That's how you can heal and purify and get rid of the stress and fatigue, unknot the knots, bring the chemistry back into balance, and do other things that are abnormal. Because the body wants to sustain a level of homeostasis,
Mm-hmm.
but we're giving it too much to do. And when we have COVID and other things, that just adds to the level of activity of the mind to where you can't sleep. You can't do the things you're supposed to do. So just learning how to be still is a blessing. And that could help you for a long, long time.
Yeah. There's medicine in the pause.
Oh, yeah.
Yeah. Dr. Griggs, how do you deal with all this stress?
So one thing, in the light of COVID-19, Dr. Alexander and my team know I've been busy, 18-hour days, 7 days a week since March 13th. Constantly, I did have to do exactly that. I had to learn to be still, disconnect. At one point, I had 3 phones, and people were reaching out to me on DM, my cell phone, the whole nine. I literally started running long distances, running between 8 to 16 miles a day. Saying I'm going for a quick run is one thing, but when you tell somebody you're running 10, 12, 15 miles, oh, no, never mind. Look, I'll be all right. Just be careful and call me. Don't run too much. And I know it's finding and defining a space for you, especially, let me tell you, we're going to be real, talking to most Black folks that I deal with in my circles, they think I'm crazy. Bro, you don't have a car? Can't you call an Uber? You need a bike? What's wrong with you? Something, bro, you must have a lot on your mind, bro. Keep running. So I literally am running away to run to myself to hide. So it helps me.
That's excellent. Miracle?
Music is definitely, you knew I was going to say that, huh, Doctor?
I did.
Music is definitely a stress reliever for me. I listen to all types of music. I listen to classical, jazz is beautiful. There's something about music that just helps to relieve the stress, according to what type of music you're listening to. You know, if you want to unwind, you'll play something that's, just more just laid back. And there's certain frequencies in music that can calm your spirit and calm your mind. And another thing that has worked for me is learning how to handle stress, is to learning how to compartmentalize things. Because what's urgent for somebody else may not be urgent for me. And what's important for me is important for me, but may not be important for that person. So it's knowing what to focus on at that moment. You know, what this is important, this is not important. So just that's another thing to help with stress, knowing what to deal with first, what fire to put out, and what stuff just let it burn.
Yeah, I like that. Miracle, do you journal?
I do. I do.
Yeah, I figured you did because you write a lot of music as well. By the way, for our audience, the frequency that she's speaking of, that's love frequency.
Yes.
The highest is 525 hertz. And also the beat that you should try to match your music with is what? What to the heart?
Was it 180?
60. So you can do 55 to about 55, 70, you're getting a little fast.
Okay.
Listen to music that's matching your heartbeat. That usually brings your pressure down, your pulse, and you're at a better sense of calm, as Dr. Kandwani says. Free, let me hear from you. How do you handle all this stress?
I think one of the major things.
And perhaps she had an emergency she needed to attend to. Dr. Alexander.
No,
how do you handle stress? I know you're off camera. Because he's a busy man. I'd like to hear from him.
Thanks, Zelda. Yeah, I manage stress through music, and I walk a lot. We have a lot of hills here in Oakland, and I'll take a nice 9-mile walk sometime, and when I come back, I'm in a blissful space.
Mm-hmm.
And I love the ocean. The ocean calms me down.
That's mine too. I love the ocean. I like to look at water. So you're doing something really good, somatic, physical, and then you're doing music, and then you're also doing visualization. So I think that's an excellent modality that I think more people could use. Building I think they call it a visual board, or if you have a PowerPoint, I load up lots of pretty pictures of things. And then I have themes. So these are all the places I'd like to go. Or these are all the things I'd like to buy. Okay. That's a very good form of visualization. I try to visualize, play music at least twice a day. Just step away from everything. It might just be 15 minutes, but I found it to be very therapeutic. Well, that was a good discussion, everyone. Here's the last question. How do we get to happy?
I want to defer to free.
Or free? Is free available?
I am. Can you hear me?
I don't think Free is available.
Can everybody
Dr.
else?
Griggs, how do you get to happy?
So
How do we get to happy? Give us some tips for our audience.
that depends on the goals. Real quick, what I tell people to do is start every day with a smile. I want you to wake up every morning, wash your face, look yourself in the eyes, and smile. We stimulate the alpha neurons by mirroring and knowing that we're okay. You take a deep breath, you breathe, you check your environment, you know everything's going to be fine. You call and check on your mom, check on your family, and then you take a step back into your day. And most importantly, and this is ceremonious, because it happens when things happen during the day, you go in the bathroom and you flush the toilet. Because whatever happened is bad, you flush it and you leave it there in that bathroom and walk away from it with a clean slate. Your happy is defined moment to moment by no one but you.
Yes.
So, Free?
Yes, I'm
Free's not
here.
available. Dr. Kandawani, how do we get to happy? Give the audience some tips.
I think the more we know who we are inside, the happier we'll be.
Yes.
And when we get to the experience of knowing from experience that we are this infinite being, you know, having a human experience, then you know, that for me is the happiest time that I can be. It's when I don't even know who I am in this deep experience of meditation. That means I'm everywhere at the same time. And that to me is a fundamental experience that I think that we used to have as humans, and that we celebrated in Africa. One of the main directives there was just to know thyself. So if we know who we are, then all of this stuff around us, you know, it has an effect, but it doesn't damage that infinite part of us. It can't touch that. You know, it might touch our body, it might touch our mind, but there's a part of us it can't touch. So that makes me happy when my world goes from this experience to an infinite experience. That makes me happy.
So, Miracle, give some tips for our audience how to get to happy.
I have to piggyback on Dr. Kandwani about it's about knowing yourself and knowing that you have the power to create your own happy. And when you get in touch just more spiritually, not being religious, but spiritually, just knowing that you come from a higher power, a God, an infinite power, God, our creator, the I am, that capital I, capital A, capital M, when you know that I am lives inside of you. And it's easier said than done sometimes, but you have to just realize you have the power to create your own happy, no matter what situation that you're going through. It's all about the mindset. You could have the same problem the same next day. But again, it's all about your mindset, changing your mindset. And it's up to you to create like your own happy, just to know that I can be happy. I have the power to change my emotions. I don't have to stay here. And a good example is you could be crying, but you could have a family member or a friend who you're close to. They could say something and you would just start laughing. In that moment, they caused you what they said caused you to smile. So it just shows that you could take your attention off of the negative and then focus on the happy. So, and knowing that we have that power in us to bring that about.
All right. Well, I think we're about at the end of our time. Thank you, panelists. All of you provided really excellent solutions to trying to get to happy, and we hope that for everyone. Dr. Alexander?
Thank you, Zelda. We're grateful to our panelists, and we thank them for their service to our communities. The resources that they've introduced this evening will be posted on the health and wellness page of our website, 100blackmen.org. The next webinar in our pandemic series will be Thursday, December 3rd, when we will provide updates on COVID-19 vaccines, testing, and therapies. On behalf of our chairman, Thomas Dortch Jr., and the members of 100 Black Men of America, we wish you all a safe, happy, and healthy holiday season. And we want you to hang in there. Just know that brighter days are on their way. Thank you.
Thank you, everyone.
Thank you.